Webinar 4, Current Treatments. We found a mass. Good news is we have weapons of mass destruction. So where do you start? There's all these different kinds of treatments. You're starting to learn new words, new types of radiation, new types of chemotherapy. People are telling you this, telling you that. And also you may have second opinions that don't always agree with each other. So where do you start? So let me break this down for you. Surgery, surgery, surgery. Surgery with clear margins is our most effective treatment, hands down. Now there's different types of chemotherapy. Cytotoxic means it kills all fast-growing and healthy cells and cancerous cells in your body. So both healthy and cancerous cells. Targeted disrupts pathways to cancer cell growth. Hormone blockers affect tumor growth by blocking hormones and hormone receptors. Immunotherapy helps your immune system recognize and destroy cancer cells. Then there's radiation. There's external beam radiation, and that's just full field. And then there's interventional radiology. And to name a few, that's CyberKnife, radiofrequency ablation, cryoablation, high-intensity focused ultrasound, and chemoembolization. So these are our most common chemotherapies for LMS. It's not all of them, but I wanted to show you the response rate. So number one is gemcitabine and Taxotere, we call Gemtax. It is a cytotoxic chemo, and it's 35% response rate. It can go up to 55% response rate for uterine LMS. Doxorubicin and ifosfamide, that's a cytotoxic, it's 30%. Doxorubicin, also known as adriamycin, is 25%. Doxorubicin, and a new drug that we have, olaratunib, is 18%. And Yondelis or trabectedin is 18%. And Votrient is a targeted drug, and that is 6%. So let's go back to the issue of adjuvant chemo. And that's when you take chemotherapy when you don't have any evidence of disease or NED. It's quite controversial. There's no evidence that taking adjuvant chemo extends your survival rate, although it might be beneficial to help control local reoccurrence, especially in cases where the tumor was cut up or morcellated. The problem in taking adjuvant chemo is you have no way to know if it's working or not. If it's not working, you're exposing your body to a harsh drug with side effects and using up time for no reason. Most doctors like to save chemotherapy for when there's a visible tumor to measure to see if it's effective or not. Clinical trials. When should you look for a clinical trial? So number one, if you've exhausted all the regular approved treatments. Number two, if there's a promising new drug that you really want. Where can you find these trials? You can go to clinicaltrial.gov and search for leiomyosarcoma or solid tumors. And how do you get enrolled in the trial? You can contact the person listed on the trial page to see if you qualify, but you should discuss a trial with your doctor. But you don't have to have them give you a referral. How safe are trials? So the higher the phase, the safer the trial is, because it's been already used and experimented with several more people. In phase 1, they're really asking the question, is this drug safe? And if so, at what dosage? They usually enroll 20 to 80 people. At phase 2, the question that they have to answer, is this drug effective for LMS? And that enrolls more people, 30 to 100. Phase 3, so the question to be answered is, how does this drug's effectiveness compare with the existing approved drugs for LMS? And you have to look at what they're comparing this drug, this new drug to get a better sense of how effective it is. It enrolls 100 to 300 patients. Now you see we are very rare, so to get 100 to 300 patients in a clinical trial takes several years. So one area of treatment that people overlook or don't know a lot about is interventional radiology. And this is good when you can't operate on a tumor. Interventional radiologists use minimal invasive image guide procedures to kill the tumors in almost every organ. One example of what they can do is chemoembolization, and that delivers an anti-cancer drug directly into the tumor through the blood vessels. Some more examples: radiofrequency ablation, or RFA. They use electrical energy to heat up and destroy the cancer cells. Cryoablation is destruction of the tissue by freezing. Microwave ablation obviously uses microwaves. High-intensity focused ultrasound, that's HIFU, that targets cancer cells with radiation-free sound waves. And CyberKnife, it's a robotic radiosurgery that delivers high doses of precisely targeted radiation from outside the body to destroy tumors inside the body. So in the pipeline, the hottest new treatments are immunotherapy. And the goal of immunotherapy is to teach your immune cells that a cancer cell is a bad guy to be destroyed. So you could have a perfectly good immune system, but if it doesn't recognize the cancer cell as cancer, it just passes right by it. Now, some of these cancer immunotherapies target the tumor, and some activate the immune cells themselves. And when you see it split up, these are all different types of immunotherapy coming out. So back to square one: when in doubt, cut it out. Surgery is our most effective treatment whenever possible. So one thing is, a lot of times an oncologist will say, your tumor is inoperable. But we tell you to go get a second opinion from the actual surgeon to determine if they can take it out or not. So he got a little too much of the margin. So we now have several different ways to treat LMS. Surgery with wide margins is the most effective treatment. Systemic chemotherapy is used when surgery isn't possible. Cytotoxic and targeted chemos, hormone blockers, and immunotherapy are being used and developed for LMS. Interventional radiology offers ways to destroy tumors. There's CyberKnife, RFA, HIFU, cryoablation, and chemoembolization, just to name a few. But remember, LMS is very chemo-resistant. When considering chemotherapy, ask your doctor what the response rates are and compare your options. Adjuvant chemo doesn't extend survival. Most doctors try chemo when there's a measurable tumor to monitor. Clinical trials offer opportunities to advance research as well as get new treatments before they're approved by the FDA. Find trials yourself by searching clinicaltrials.gov. Contact the trial doctors directly and get the details. You do not need to have your doctor's referrals. More and more treatment options are emerging, so stay alive until the right one comes along for you.